the minister responsible for seniors affairs.
Thank you, Speaker. Speaker, I rise today to remind my colleagues that October 1st, this coming Saturday, is National Seniors Day. It is also the United Nations International Day of Older Persons. We are proud here in Ontario to take part in observing both. We are proud to pay tribute to the women and men who helped build our province and our country. And we are proud of the many valuable contributions that seniors continue to make in our society. They enrich our communities, they enrich our workplaces, they enrich our lives. Speaker, Ontario, like other jurisdictions, is dealing with a major demographic shift that has seen the number of seniors in our province increase significantly, and we know that the numbers will continue to grow. This is what I think about every day. There are over 2 million seniors in Ontario. In 25 years, there will be about 4 million. For the first time now, there are more Ontarians over the age of 65 than there are children in Ontario under the age of 15, and I'm sure the pages are listening intently to that. What's even more striking is the diversity of Ontario's seniors. Just under half are immigrants. Many live in rural and smaller communities, and as many as 7% are not fluent in either English or French. So this is a change that is unprecedented in modern times for Canada. And the Ontario government, like governments in Canada and around the world, recognizes this reality. Today, people are living longer, active, productive, healthier lives, and that has a host of implications for policymakers in all fields. And I think it is my job, in fact, I think it is our job here in this chamber, to ensure that Ontario seniors are able to live those extra years with purpose and dignity. Speaker, Ontario has long recognized the importance of supporting and honoring seniors. And through the work of our Senior Secretariat, we have supported policy and program initiatives that help improve the quality of life of seniors. I'd like to take a few moments now to tell my colleagues about some of the many ways we are working to keep Ontario seniors healthy, happy, and independent, because they deserve nothing less. It starts with Ontario's Action Plan for Seniors. You're already there, I'm getting there. A plan we launched in 2013 to help us meet the challenges posed by an aging population. The Action Plan is a groundbreaking strategy that stresses first and foremost the importance of creating age-friendly communities. What do we mean by age-friendly communities? We mean inclusive, accessible environments with programs and services that make a difference in the lives of older adults. We mean communities where seniors are supported and empowered to stay healthy, active, and engaged with the people and organizations around them for as long as possible. Supporting age-friendly communities is a key component of Ontario's Action Plan for Seniors. And since the release of that plan, we've launched a number of initiatives intended to do just that. In 2013, we released the Age-Friendly Community Planning Guide, which explains the characteristics of an age-friendly community and how it can respond to the opportunities and challenges of an aging population. The guide outlines step-by-step processes and tools to help municipalities and communities develop and implement action plans that will lead to senior-friendly communities which are socially and physically accessible and inclusive. We are also supporting municipalities and communities in their efforts by investing $200,000 in the Age-Friendly Communities Outreach Initiative, which provides education and assistance to communities interested in adopting age-friendly planning principles. So if there are MPPs here who would like to see their communities involved with this, please let me know. Beyond education, however, we are also investing in specific projects. The Age-Friendly Community Planning Grant Program, which we launched in 2014, is already providing funding for 56 projects across Ontario. This funding is supporting communities in the development or improvement of age-friendly planning. The program is encouraging municipalities to apply an age-friendly lens to all areas of local planning, and it is also building awareness and momentum across the province so that all communities are encouraged to embrace age-friendly planning and raise the standards they have in place. Another program we launched in 2014 was the Seniors Community Grant Program to support small community projects that help keep seniors connected, active, and engaged. Grants under this program range from $500 to $8,000. I'm talking about things like dance classes, day trips, and reading clubs, as well as information campaigns or speaker series on topics such as financial literacy, hands-on computer workshops, and many intergenerational projects. These projects help seniors stay engaged, contribute to their local communities, and avoid the harm of social isolation. Speaker, since its launch in 2014, the program has given more than 256,000 seniors the opportunity to enjoy activities in their communities and beyond, so that the richness of their experiences and learning continues to flourish. To date, we have invested approximately $5 million in this program. Another important community resource for seniors are elderly person centers, or EPCs. There are 263 of them across the province, and more than 100,000 seniors benefit from the services they offer every year. Seniors are offered access to social and recreational programs such as fitness and cooking classes, Meals on Wheels, various transportation services, and falls prevention classes. They also receive health education and support services. Clearly, the EPC program is one we value, and it is key to keeping seniors active and engaged in their communities. Speaker, I have been speaking until now about the various ways we have been attempting to improve the lives of seniors within their communities. But as my colleagues are well aware, sometimes you have to do more than encourage a happy life. You also have to ensure a safe one. We never lose sight of our obligation to protect Ontario seniors. And sadly, one of the things we have to protect them against is elder abuse. This isn't something anyone wants as an issue, but it is. It can be emotional, it can be physical, it can be financial, or it can be just plain neglect. It is abuse, and our government is determined to address it. Ontario was the first province in Canada to introduce a strategy to combat elder abuse. This strategy focuses on raising awareness, coordinating community services, and training frontline staff. Over the past 5 years, through our strategic partnership, we have trained more than 29,000 frontline workers in a variety of sectors, from health to justice to the social services, education, and volunteer sectors, to recognize and respond to elder abuse. We have also reached more than 46,000 individuals through public education sessions delivered across the province. We are in the process of reviewing our current strategy in order to ensure we are providing the very best services and protection for today's seniors. I should note that we have also created mandatory annual training on elder abuse for the Ontario Provincial Police. And we have shared this training with other police services and community agencies. Elder abuse, Mr. Speaker, is a very serious issue. And I can assure my colleagues that this government is determined to do the utmost to protect our seniors. Another issue of great concern is related to the safety problems caused by dementia. Nearly 221,000 Ontarians have dementia. Many of them at one time or another have wandered away from their families, homes, or caregivers. This is a grave concern. In 2013, in partnership with the Alzheimer's Society of Ontario and law enforcement groups, we launched the Finding Your Way Wandering Prevention Program. We are investing over $750,000 in this program every year. This multicultural program is intended to help people with dementia, their families, and communities to recognize and reduce the risk of going missing, and provides practical advice and tools for handling situations should a wandering incident occur. Program resources are available in 12 languages and include public awareness materials and a safety kit. Last year, we began to expand the focus of the program to help those with dementia live safely in their communities through such efforts as educating of service providers, for example, emergency medical services about dementia and wandering prevention activities. This year, we are rolling out newly developed training resources and recruiting more volunteers to improve community preparedness and response to wandering incidents. As you may know, the Ministry of Health and Long-Term Care has been leading work on the development of an Ontario dementia strategy, and last week launched consultations to help develop this strategy. I encourage all members to review the paper and participate in the consultation process, whether online or in the forthcoming town halls that the Ministry of Health will be leading. We know dementia care and the availability of supports are important issues for seniors, their families, and caregivers. And we wish to ensure our partners and stakeholders are aware of this important consultation. We've also taken action, Speaker, to protect seniors from fire by requiring facilities housing vulnerable Ontarians, including retirement homes, to be equipped with automatic sprinkler systems by January 1st, 2019. Ours is the first province to make sprinklers mandatory in existing licensed retirement homes and facilities housing seniors and other vulnerable citizens. To help with this transition, I will be working with my cabinet colleagues in the coming months to develop a funding model to help small or rural retirement homes that would not otherwise be able to afford to install automated sprinkler systems in their homes. In January of 2014, a number of fire safety measures came into force, including changes to the fire and building codes. In addition to requiring automatic sprinklers for all existing licensed retirement homes and care homes, other changes included requiring fire safety measures such as self-closing doors, enhanced fire inspections and staff training, and annual validation of fire safety plans by local fire services. These measures will increase safety and provide peace of mind to seniors living in retirement homes, as well as to their families. Retirement homes, I should note, are also now required to implement a number of protection measures in the Retirement Homes Act that enhance the safety and care of residents, and also give seniors and their families clearer information to help them make informed choices about their accommodation and enforceable rights while living in retirement homes. That legislation was a historic step. For the first time in Ontario's history, governments established legislative protections for seniors living in retirement homes. Speaker, the final thing I want to touch on today is the health of our seniors. I say with real pride that our government is in the process of transforming health care under the leadership of Minister Hoskins in order to make Ontario the healthiest place in North America to grow up and grow old. Our goal is to deliver health care that puts patients at the center of the system, responds to their needs, and makes it easier for providers to deliver care to those who need it when they need it. This includes making investments across the healthcare system to better support seniors so they can lead a healthy, engaged, and active lifestyle for as long as possible. We know that better community care is critical to support seniors who want to remain independent for as long as possible. As announced in the 2016 budget, our government is continuing to fund growth in home and community care at about 5% per year to 2017-18. We're also investing an additional $75 million over the next 3 years in community-based residential hospice and palliative and end-of-life care. We are investing an additional $10 million annually in Behavioral Supports Ontario for initiatives to help residents with dementia and other complex behaviors and neurological conditions. We're increasing the income threshold for low-income seniors under the Ontario Drug Plan in order to make access to drugs more affordable for an additional 170,000 lower-income seniors. And just 2 weeks ago, I was able to announce that we are providing the shingles vaccine free of charge for Ontario seniors aged 65 to 70. Shingles is a painful and potentially life-altering disease. These are the kinds of support measures that will help more seniors live healthier, happier lives. Speaker, I've not been in this position very long, but the months I've been here have convinced me that there are few responsibilities we have as a government more important than securing the safety, dignity, and comfort of our seniors. I want to end by sharing a small story. This weekend, Mr. Speaker, I had the pleasure and the honor of actually attending the 100th birthday of a constituent of mine. And it was such a wonderful experience because I went into this restaurant in the Riding, and this lady, 100 years old, but cognitively all there. I mean, she knew everybody. When I was introduced by her son, she knew exactly who he was referring to. She was thrilled I was there. But to me, the best part of it all was she was surrounded by 90 people, friends and families, and not only did she have all her children, not only all her grandchildren, not only all her great-grandchildren, but also her great-great-grandchildren. She was born in China, raised in India, lived in Aden, and then finally moved to Canada. And as I stepped out of there, I couldn't help but think, if I was to live to be 100, how many people would show up at my 100th birthday party? I mean, that's a question. Oh, there you go. I got 5 people coming. But I think it was all about, it raised the question about what it means to lead a well-lived life, and seeing it in that lady reminded me of what it means to live a well-lived life. And as the minister responsible for seniors, I think that is one of my primary responsibilities to work on that. Thank you so very much.